Hi everyone, today we'll be learning on how to better manage diabetes during the month of Ramadan. Ramadan is considered the holiest month in the Islamic calendar for Muslims. It is also a month of fasting, worship, and the giving of charity. The act of fasting can improve blood sugar levels, but for those with advanced diabetes, complications, and high blood sugar readings, it is associated with certain risks if one does not prepare adequately to manage them. So, how does one manage diabetes while fasting? In this video, we'll explore key strategies for safe fasting with diabetes during Ramadan. Fasting during Ramadan can cause our blood sugar levels to fluctuate. This is more significant in people with diabetes due to diabetic medications and the changes that occur in the body during fasting. When your blood sugar levels are too high, this is known as hyperglycemia. This can occur if one overeats during iftar. When your blood sugar level drops too low, this is known as hypoglycemia. This can occur at any time, often due to several factors, such as strenuous physical activity or exercise, not delaying sahur and not breaking fast on time, and lastly, because diabetic medications have not been reviewed and adjusted by a healthcare professional. Both these conditions are risky and can be harmful. Hence, it's important to monitor your blood sugar levels regularly and talk to a healthcare professional before Ramadan starts to review one's diabetes treatment and management during Ramadan. Fasting during Ramadan also increases the risk of dehydration. Some factors that contribute to this increased risk include medications that cause frequent urination, fasting in hot weather, not drinking enough water during sahur and iftar, and long fasting hours. Moderate to heavy intensity exercise should be avoided during fasting hours, as it may lead to an increased risk of hypoglycemia and dehydration. If one wants to exercise, it will be best to exercise at least 2 hours after iftar. Physical exertions involved in the Tarawih prayers, such as bowing, kneeling, and rising, can be considered part of daily exercise too. For individuals on medications for high blood pressure, it is advised to stand up and rise slowly during the prayers to avoid symptoms of low blood pressure such as dizziness and fainting. Knowing the signs of high and low blood sugar can help you stay safe. Hyperglycemia or high blood sugar levels can cause excessive thirst, frequent urination, hunger, fatigue, nausea, and vomiting. Some signs of low blood sugar or hypoglycemia include trembling, sweating, palpitations, confusion, fatigue, and dizziness. Dehydration and its symptoms include dry mouth, concentrated urine, dizziness, and headaches. Blood sugar monitoring during Ramadan is important as it allows us to fast safely. The monitoring of blood sugar is highly encouraged, especially for patients on insulin, who have risk factors such as the history of hypoglycemia or low blood sugar, and those who are fasting for the first time with diabetes. Nevertheless, it is still important for people with diabetes to monitor their blood sugar levels regularly, especially when taking medications like insulin. Remember, the act of checking your blood sugar levels does not invalidate your fast. It is advised for you to measure your blood sugar levels at these timings: before sahur, at midday, between 3 to 4 p.m. and 5 to 6 p.m. due to the high risk of hypoglycemia, 2 hours after iftar or after Tarawih prayers due to the risk of hyperglycemia, and lastly, anytime there are symptoms of hyperglycemia or hypoglycemia. If you experience any of the signs of hyperglycemia or hypoglycemia, you need to assess if you should stop fasting. When your blood sugar level drops below 4 millimolar per liter, it's essential to break your fast and have something with sugar to raise your sugar levels. For example, have some sweets, dates, honey, or a glass of sweet drink. You should check your blood sugar levels again after 15 minutes. When your blood sugar level rises above 16 millimolar per liter, it is also a sign that fasting might be unsafe, and it is advised to break your fast. It is encouraged for you to discuss with a healthcare professional regarding trial fasting before Ramadan starts. This can help us identify the risks and complications that may arise during Ramadan. We can also take the opportunity to fast on Mondays and Thursdays as highly encouraged in Islam. It is also recommended to fast for 3 consecutive days on the 13th, the 14th, and 15th day of Sha'ban. Trial fasting is a great way to assess your ability to fast safely before committing to the full month of Ramadan. It also helps us to train our bodies to adapt to the changes in eating and medication schedules.